We opened in 2012, and we were trying to help with some of the statistics that had come out at that time, that Wyandotte County was the least healthy county in the state of Kansas.
Wyandotte High School is a really great school in many ways. The investments on the part of the staff and of the leadership there to try and make it a high school where possibilities become realities for these students.
So at most schools, it is not a problem for students to get physicals to participate, but 5 to 7 years ago, the big issue was the lack of available physicals and immunizations. Our student population, not just because they're uninsured, but because of their illiteracy with health, they really are health illiterate, didn't know even where to go. And so that was really the initial function of BullDoc.
Their trauma is very, when I say significant, their trauma may involve, I got evicted last night. I'm out living on the street with my family. Someone knocking at the door and arresting a family member. Violence in the community. We've had students murdered. We've had students who have family members murdered. Undiagnosed mental health issues. But we see a lot of depression and anxiety. Oftentimes these students aren't dealing with one event. They're dealing with ongoing events, several events. And it just doesn't seem to stop.
Overall, I think by this point we've screened something in the neighborhood of about 600 kids for mental health issues and provided care to about 400.
Having BullDoc here at school, I can refer a kid or they can refer themselves down to BullDoc. They get pulled for maybe 45 minutes of the day and they're back in class, ready to go. And for me, that feels so empowering as a teacher to say, you're sick and I can help you and then I can teach you history.
So we've kind of been working to keep the kids here in school. So if a student has a cold and has been out for 2 days, we can call the parent and be like, parents I can't get them into their doctor for a month. So your kid's not going to miss a month of school. Bring them in. We'll take care of it here. And keeping them here so they can graduate and keeping track of these kids. A lot of times we'll have kids have a major illness that sometimes we lose them to the system. Mm-hmm. Like the kid hasn't been here in a month and no one knows why. And we can bring in the parent and they can meet with a counselor, a therapist, a doctor, an administrator, everybody.
And here at Wyandotte, it's definitely a community situation. We're raising our kids. It's not just teaching them, I would say. We're helping to raise them with the assistance of their parents, but it's not just about going to class and sitting in class. It's about taking care of the whole child so they can be successful in whatever they do.
Some people couldn't afford to go to hospital or don't have transportation, so it's better if they have going to BullDoc. And then this feels almost like home.
It's become a necessary and integral part of our school. Without this, I just don't know how much I can get done in my classroom. It feels like every day would be a triage situation with which kids aren't eating, which kids don't have a home to go to tonight, which kids are sick, and you can't spend your whole day trying to solve that.
Because BullDoc has grown so much since they originally requested the grants and the funding, every year I feel like we're always stressing out, like what are we going to do next year if we don't have BullDoc? What happens if next year we don't have mental health? Teachers are too, like what will we do here at the school if we don't have these resources? What will we do for our kids?
I feel like this is the program that should keep growing because I think without it, a lot of kids would suffer. It is highly beneficial to like at least half the kids in the school depend on it, so it's really beneficial.
We want to do all we can to kind of come alongside with them and do that piece, which we can do. There are other people that aren't yet in the mix who can come alongside and be part of that with us. We all need to be part of it. We need everybody who has passion to want to be part of it to come along.